Welcome back to the exhibit hall track at Eyes on Dry Eye 2023. I'm your co-moderator, Dr. Damon Dierker. Very pleased to have a first-timer to Eyes on Dry Eye, Dr. Sarah Darbandi. She's an ophthalmologist at Bowden Eye and Associates in Jacksonville, Florida. The title of the session is Discover the Difference, a compelling testing and treatment OSD solution with long-term benefits. And this is sponsored by E-SWIN USA. Dr. Darbandi, welcome to Eyes on Dry Eye. How are you doing?
Thank you. Thank you. I'm doing really well. Thank you so much for having me.
So tell us a little bit about your practice and your interest in OSD before we get into our topic, looking at the treatment solutions as well as diagnostic solutions that E-SWIN has to offer.
Absolutely. I am a cornea specialist and I practice in Jacksonville, Florida at Bowden Eye and Associates. I'm also a part of our dry university. And so for the last 10 years, the ocular surface disease management has been such a priority in a way that we're not only, taking care of patients, but we're teaching other doctors, what to do and how to do it to take better care of their patients. So we're really excited, to have E-SWIN as a part of that world as well. One thing that's interesting about our practice is that in addition to cornea and external disease, I've always practiced aesthetics. And so that includes, the intense pulse light for skin treatments and things of that nature. So I have some additional experience in that realm, and we're so excited to have this technology now for our dry eye patients. So that's where my experience is.
Great. I mean, we're so aligned on our passions. I've been in dry eye education for not quite a decade, but for the last 7-8 years, it's been a real passion of mine. So it's great to be able to work with you on this event today. So tell us a little bit about E-SWIN USA.
Yeah, E-SWIN USA is a company that has been around for some time now. And the E-SWIN USA company is a subsidiary of the E-SWIN Group, which is based in France. And they have a strong presence. I think it's in over 50 countries. More than 2,500, eye care physicians are using this technology. So while not everybody maybe has heard of it, they should, because it has a huge presence internationally.
So not new technology to the world, but maybe just the last couple of years to the US. And reminder, Eyes on Dry Eye, we have practitioners from all over the world. It's just really a unique event. So awesome. You are speaking to the world today about E-SWIN USA.
That's awesome.
So I understand there's both a diagnostic and a treatment solution that E-SWIN USA offers. Can you tell us a little bit about the diagnostic solution?
Yes, so their diagnostic solution really takes care of a lot of problems in the office. Not only are the diagnostic testing that they offer, very complete, but it's very efficient. And so when I think of, the different metrics that we have in the office, where for us, it started out with just, maybe tear osmolarity or inflammatory, one or two of these, now we're looking for, Demodex, we're looking at redness, we're looking at tear breakup time, tear lake measurements, and a lot of these more specific things. So what the tear check dry analyzer has been able to do is to really make the efficiency and flow in the workplace very good. And so basically with its multiple tests in one machine, the technician can run, these multiple tests on the patient without having to leave the room. It's all in one place. And additionally, the report that's generated is just one sheet with all the diagnostic, data and information. So that's where it's been, the technology really excels in that it's user-friendly, it's very simple, and the device itself actually is very compact, and doesn't take up a lot of space. So for a lot of practices, that can be very important.
Yeah, so this track is all about implementation and efficiency, technician buy-in, practice buy-in. That's huge to be able to make something happen. So with the tear check, I know it's got a lot of different tests on it. Can you kind of run through what that looks like as far as different things that are available and then what you're doing in your practice?
Yeah, so the tear check, what we're doing a lot of these things in our practice, with looking at these certain metrics. What the tear check offers specifically is looking at the blink rate. This is so important, not just for our adult patients, but for pediatric patients, because so many people and children are partial blinkers, and that incomplete blink can drive a lot of the imbalance of the tear film. That can be the first start of the exposure. So being able to identify that and show patients that can really be, just a really important, strong piece of data to show somebody the initial, starts of dry eyes. It also will measure eye redness. It takes a really high magnification photo of the lashes to look for collarettes. So with your search for Demodex, it can help with that and provide images. It provides a tear breakup film time and shows the tear film instability as well. It does meibography images. And what's really neat about the meibography images is that it's not just a great quality image, it's actually calculating the percentage of gland loss. So for a lot of practitioners, thinking about doing other treatments, this is such a powerful metric to help even develop the standard of care to say, at this percentage of gland loss, we're going to recommend probing or LipiFlow or all these other thermal pulsation treatments that are out there. So it kind of takes the guesswork out and helps to standardize even the interpretation of the treatments. Additionally, it does the ocular surface inflammatory evaluation, which is basically a assessment that shows areas of the ocular surface with increased risk for inflammation. It calculates the height of the tear meniscus and also provides the eye fitness test, which is similar to a lifestyle questionnaire. What we use is the SPEED score to help identify the patient's symptoms and comfort. And that also is an important metric to be able to tell patients how they're feeling at that visit compared to other visits, because it's another important thing to show them that they're getting better, or alternatively, if they're having a flare up and maybe need more, treatments. So the diagnostic testing is remarkable and very complete.
So you've got these 9 different options for diagnostic tests that's delegated to a technician upstream. And then how is that information brought to you and the patient in the lane?
That's a really good practical question, because I think for everybody's, electronic medical record system and everything in that way, we want to know that it's easy to store the data, provide it to the doctors and all that good stuff. So basically it will print out all the information on one sheet in a PDF form, and then it can be wirelessly transferred, to the electronic medical record. So it makes it very simple to kind of store this data, bring it up, visit, and look at it again.
Yeah, I think it's been so critical in the success in my practice is having those images and data to be able to not only show at that initial visit, but at a follow-up visit to kind of track things with the patient. Patients are much more engaged, and I think this is a fantastic solution.
Oh yeah. And you probably have patients too that want to know what their metrics are compared to last time. What were my gland counts? What were my, percentages? They've become very engaged.
Absolutely. And I know that that patient is going to be with me for a long time because I've provided a level of service that they've not had elsewhere.
Yeah, that's exactly right. When they see how nice and compact the technology is, and that it's not a big burden on their time too, I feel like they're more inclined to be agreeable to having it done at the next visit, where sometimes we do get a little pushback, for patients not wanting to have certain testing or in a hurry, things like that. So E-SWIN's really made it a lot simpler for the patients and the doctors.
So that's tear check on the diagnostic side. Big part of what we're doing for OSD treatment is in-office solutions for dry eye MGD rosacea. What is E-SWIN USA's treatment solution?
So the E-SWIN's treatment solution is the regulated intense pulse light treatment. So this technology has been really amazing. It basically is utilizing all the basics that we know about intense pulse light, which have been used in the world of dermatology, aesthetics, and all that good stuff before. But it's doing it in a way that the technology allows the treatment to be effective. And the big thing that I notice is that it's less painful for the patient, because with the intense pulse light that's regulated in a homogeneous 8 pulses of intense pulse light, with time in between where it's resetting, it allows the skin to be able to have the treatment without this big blast of heat energy like some other intense pulse light and some older technologies. have utilized that not only causes the patient to have pain and almost brace themselves for the treatment, it can even create a lot more redness in the skin and even issues with the skin that you may not be anticipating. So to me, E-SWIN has really made it so that the technology is safer. And so if you're a provider that's new to the intense pulse light treatment, the E-SWIN's basically made it so that you can very easily go on, set the treatment. It's really choosing the settings for you because the technology is so advanced, and you can apply the treatment in a safe way that's consistent across the board.
Does the IRPL technology with E-SWIN's technology, does that make it more efficient in delivering a light therapy compared to other technologies that you've used?
Oh, yeah. Yeah, it makes it more efficient, because you're basically treating, a larger area of the skin in a way that basically allows you to effectively treat rosacea, but at the same time, you're not causing the patient to jump. So for example, I've used the older intense pulse light treatments, and I would have patients kind of startle or jump when we were doing the treatment. We've always said it feels like a rubber band snapping against the skin. And so I actually had a patient today I was treating with the RIPL E-SWIN's unit, and she had had the other before, and she was like bracing herself for that more intense treatment. But because it was not painful at all, I was actually able to do the treatment, which for her, we were treating from tragus to tragus in the infraorbital area for dry eyes, but also her full face for some aesthetic concerns. And I was able to complete it more efficiently because the patient tolerated it better, and it went along, much quicker and easier. And she was so happy with it. It was great.
Now, in your practice, do you have a technician that will prep the patient and do consent process, and you come in and just do the treatment itself, or how does that look in your practice?
Oh, great question. Yeah. So usually in the exam room, I'm discussing the treatment. Many times what we'll do is that if we have, for example, a new dry eye patient, they'll, have their testing done. They'll talk to the dry eye counselor just to kind of outline some of the different options. And then I meet with them and I make the recommendations, and we talk about it a little bit more. They usually go back to the dry eye counselor, and then that's when we'll usually get them, scheduled for what they need. So, and then, if they're doing the treatment that day, that type of thing, the technician will take them and basically help to just gently wipe off any makeup they might have on, apply the IPL gel, and then, I basically come in and put the goggles on and get the treatment going.
Great. So how does IRPL actually work? What is it doing to help these patients with dry eye and MGD and rosacea?
So it's doing a few things. So intense pulse light is basically using light energy to travel into the skin. With the RIPL, it's actually going about 4 to 5 millimeters into the skin. Our goal with intense pulse light is basically transferring that light energy to heat over anything that's pigmented. So when patients have small blood vessels, capillaries that are dilated, inflamed, those capillaries are drawing in inflammatory cells and mediators to the lid. And so by treating around that area, the light is basically causing some venous thrombosis because it's targeting that pigmented hemoglobin molecule. And then that heat will help to close those little blood vessels. So in that way, it really helps to prevent further inflammation that comes downstream. The other things that it does is that basically with the light, and its ability to stimulate certain cells, it can upregulate the kind of anti-inflammatory cells that we need and help to downregulate the inflammatory cytokines, things of that nature. I like it also for the aesthetics patients because it does have an effect of it stimulating the fibroblasts that secrete collagen and elastin. So it gives over time a more glowing appearance of the skin. And I know this from experience because I've had IPL treatments myself for the last 10 years. So I know that, it really does have those aesthetics, benefits as well. And your patients are always so happy to hear, the nice side effects of your skin will be more, even and has some good positive effects for the future.
So if you have a patient that you've identified as a good candidate for IRPL, what does that look like in terms of the number of treatments? Do you do a treatment course? How often do they need to have maintenance treatment? I know there's different thoughts, different technologies. How do you do this with IRPL in your practice?
Yeah, for most patients, the treatments are going to be every 3 to 4 weeks. There are some patients that can have it a little further out. For example, if I have somebody who has really significant rosacea, I might give them a little bit more time between treatments. And the other thing too is that because, this is a chronic condition, many patients understand that even after their 3 to 4 weeks, frequency of sessions, that they may need some maintenance treatments. And that looks like basically one treatment every 3 months just to help maintain. Living in Florida, a lot of these patients are very receptive to that because they understand they're, exposed to the sun, they understand that they're using their eyes. There can be flare-ups, allergies, things like that, will cause this to recur. So just kind of managing those expectations. I love for patients to maintain their effects, with IPL sessions throughout the year.
So you've mentioned already that the mechanism of action is primarily anti-inflammatory. Do you treat patients' gland obstruction at the same time that you're providing IRPL? Are you doing manual expression? Do you do thermal pulsation? Can you combine this with other
Oh, yeah.
technologies?
For sure. Yeah, we offer the patient different options. So if I see a patient that is a new patient and they kind of need some cleanup, things like that, I might start by doing an eyelid cleaning procedure, and then if I need to reopen the glands, I might do my Bowman gland probing, and then some type of thermal pulsation can be done after that to help evacuate the glands, whether it's LipiFlow or tear care or iLux. Those are all, perfectly fine to do. And then lastly, I would do a session of the intense pulse light just to treat the skin, and help with that inflammation and the prevention of other issues. And then we just continue with the IPL sessions every 3 to 4 weeks. The other thing is that we do offer patients that maybe they've had those things done and we're interested in intense pulse light. They may do the intense pulse light and we do an expression of the lids afterwards, where basically I'm manually expressing the lids right after the first session of the IPL, but I don't necessarily do the expression every treatment.
Great. So tell us a little bit more about working with E-SWIN USA. I know that's a really critical part of our success, is having industry partners that are good friends and support our practices.
Yeah, that's such a good question. And I've had experience with this recently. So, I've used other devices, tools in the office, things like that. And what you want is a company that's going to be reliable and that's going to be there when you need them. Because, I've been in the situation where years ago, the intense pulse light machine I was using had an issue where it just wasn't turning on. Of course, we had a patient ready to go. That seems to be only, the time when these things happen. So, basically, to try to get somebody to have a service call and all these things, I had to reschedule the patient. With the E-SWIN, if I ever have a question, I've got my, representative right there. I've got so much contact information. And also too, this is all included with the machine and the technology. With the other companies, a lot of times you're paying ridiculous amounts for service-free calls, upwards of thousands of dollars, just to get somebody on the line to help you. That might not even be something they can, address right there. So it can be frustrating and expensive. With the E-SWIN company, they've bundled all that together. So you've got that safety net that if you need support, anything with the machine, really, they're right there, in real time. So there's a lot of reasons to partner with E-SWIN USA. One of the biggest things is basically they have this exclusive connect and package where they're providing all the consumables as well as the service calls in one bundled price that basically beats out, just really all the competitors.
Great. No, I think it's pretty compelling presentation here, looking at both a diagnostic solution and a treatment solution from E-SWIN USA. We're coming up on time, Dr. Darbandi. Any final thoughts about IRPL technology?
Yeah, just the way that E-SWIN's packaged it, my day is so much easier. I can do more add-on treatments, same day, patients are more receptive to it. The technology is so easy to use. If I knew nothing about intense pulse light, I would immediately feel comfortable using this, because E-SWIN also makes an effort coming out physically to train not just the doctors, but the staff. So now, since they've come out, I've got educated staff that are able to talk to patients about it. They understand the technology. It's really incredible, and it's different than, other companies that we've worked with. They really excel in that area.
Well, thank you, Dr. Darbandi, for joining us. It's been a great session. I look forward to working with you at future Eyes on Dry Eye events. I hope everybody learned a lot about E-SWIN USA.
Awesome.